Hello, everybody out there. This is Morgan Denny coming to you live for the PT on Ice Daily Show. Before we get started today, I want to talk about some upcoming stuff, of course. If you are able, this weekend in Minnesota, Jason London is hosting his Bike Fit certification course, which I can totally say if you treat any cyclist and you don't know how to do a bike fit, this is the course for you. It can be an imperative part of their treatment schematic. Later on this month, Justin's pain course is starting, I believe, on the 28th. We've got a whole lot of other courses coming up, so be sure to check ptonice.com for those locations and dates. So, on to this morning's topic. I've got your back. So, one of the things I've noticed in working with students and younger PTs is often a hesitance to ask patients to remove clothes, to show the body part in question. And I just want to speak to that for a few minutes and talk about the importance of actually being able to see the body part that we're treating, right? So if a patient comes in and their knee hurts, if they are wearing tights, like we need those tights rolled up to see their knee. If their shoulder is bothering them, even if they're wearing a t-shirt, we may need to see further down, like we need to see the skin to see the shoulder move. If it's their back, we really need to see what's happening at their spine. And I think that this is important for both a biomechanical purpose, but also from an integumentary side, right? Like we all know we're going to see more when we remove the clothing, when we see the skin. You know, we're going to be able to see those divots in muscle mass that indicate some atrophy or potentially like, you know, spinal contributions to muscle deficiency, stuff like that. But we're also going to find things in the integumentary system that the patient's not necessarily going to bring up to us or that they're not necessarily aware of. And I think as PTs, it's not only our obligation, it's sort of our privilege to be able to help patients with a lot of these things. You know, it's like the integumentary system is within our profession. It's within our scope of practice. So it's one of those pieces that we need to be not only able but willing to check. And I think a lot of times as PTs, we feel slightly ashamed or we feel hesitant or we're nervous to ask a patient to reveal more of their body, you know, and that's understandable. You know, people have a lot of shame around their bodies. They have a lot of fear. And asking the patient to do so takes some courage on your part. But also, we are doctors of physical therapy. We're doctors. Like, we should feel comfortable and confident asking patients to remove those parts of clothes that allow us to better treat them. And I think if we do so in a way that doesn't indicate that we're uncomfortable, the patient is more likely to be comfortable too. Now, of course, that doesn't mean that patients that are uncomfortable or have some trauma in their background that we can't modify what we're doing or make them comfortable or wait till the second session when they know us better to truly evaluate at that depth. But for most patients that come into the clinic, we definitely need to be able to see the body part that we are assessing. Now, that goes into the integumentary system, right? So as PTs in PT school, we all learn some bits and pieces about integumentary system. But I think what we don't realize or what we fail to see often or to perhaps acknowledge is that a lot of people have no idea what's going on at their skin level, right? Especially on their back or their back sides. Like, people don't necessarily stare at themselves in the mirror all the time looking at their back to see if there are spots, if there are moles, if there are conditions going on. And I think even assuming that someone who is married or who has a partner or a spouse, to assume that that person is getting checked by their significant other is probably not correct. So I think we need to be more aware that a lot of people aren't even able to see the entire backside of their body, nor are they aware of the possibility that there could be something going on there. So when we're evaluating patients, not only is it important to check the skin, but it is important to make sure we kind of glance once over. You know, so if you are looking at a patient's lumbar spine and you have their shirt off, which is totally appropriate, you should probably check their thoracic spine. You should probably check the back of the bilateral scapula, see if there's something going on there. You're likely to catch some rashes. You know, you're likely to see some tiny little marks or wounds that maybe are or not healing. It's possible that you're going to see some bruises that patients didn't know they had. And while some of those are not scary or bad, they're just I bumped into something and I don't remember it, there are probably also some ones that might indicate an underlying disease process, and we need to know what those are, right? So being able to check for that stuff is not only a thing that you need to be able to do, it's a thing you need to know to do and be aware to do. But beyond that, remembering your ABCDEFs from PT school or from whenever you learned about the integumentary system, right? So A is asymmetrical. We know that most moles are symmetrical and don't necessarily show irregular borders. Borders are B, right? So anything that is fairly round and symmetrical is usually pretty benign. So A is asymmetry, B is borders. C is color. So moles that are one singular color, that kind of normal brown that most of us have 1 or 2 or 8 of all over our bodies, like that's okay. But when there are multiple colors involved, different pigmentations that can kind of blend together, that's often a sign that there could be underlying malignancy. D is diameter. Knowing that anything that is larger than a pencil eraser is considered abnormal is important. And then E is evolving, probably one of the most important factors of all. So when a patient has had a mole, an irregular spot, a something for their whole life, oh, I was born with that mole, or, oh, I've had that checked 20 years ago and it's fine, it's not changing. Probably not a big deal. But when something has shifted, when someone noticed that said mole or spot, a year ago and it's grown a lot or it's changed in color, border, asymmetry, whatever, that's probably a sign that it's evolving and changing and could be more malignant. And then I threw F in there because F is for funky looking. And honestly, a lot of little splotches, while they may fit the ABCDEFs, the real thing is F. F is what's going to draw your attention. It looks funky. It doesn't look like a freckle. It doesn't look like a liver spot. It doesn't look like your average everyday mole. It looks like something funky. So when you see stuff like this, what do, right? One of the most important things is to ask more questions, gain more information. So questions to ask would be, hey, have you ever noticed this before? Do you know you have this irregular mole, this splotch, this whatever you are noticing, this rash? And if so, do you know how long you've had it? Or do you know how long it's been since you've looked at this area of your body? Just to get a general idea of, is it something that's old? Is it new? Is it evolving? And then next to ask, do you see a dermatologist recently or regularly? Have they checked it? If they just saw their dermatologist 6 months ago and the dermatologist saw it, checked it, and said it was okay, probably less to worry about from our standpoint. But if they've never been to the dermatologist or never had it checked, that's something that we probably want to refer out. Other questions to ask are, does it ever itch? Does it ever hurt? So some of those signs and symptoms can indicate an underlying or different pathology, and ones that we may not need to diagnose or be able to diagnose for that matter, but they can feed into a better overall picture, right? So being able to ask some of these questions is really imperative from our perspective, because it's one thing to be able and then willing to check someone's skin, but it's another thing to make sure they have the right information. I think overall as well, we need to make sure when we see stuff like that, we say something, right? If you see something, say something. Because if we're seeing these things in our mind, we're kind of, debating about whether this is good or bad, or should I say something? Are they nervous? Are they fearful? Are they anxious? Am I going to ramp up their nervous system if I say this? Like, that's not our decision. Our responsibility is that when we see something that indicates there could be an underlying pathology, we need to give that patient the information, right? So we need to be able to step up as doctors of physical therapy and say, hey, I'm seeing this thing. It looks mildly concerning. I would like you to get it checked out. Not hemming and hawing and thinking whether we should say something because we don't want to upset someone, right? We need to be able to let the patient know what the situation is and that we are unsure, because we are not diagnosticians in terms of the integumentary system. And we need to remember that when we are in doubt, we always refer out. So keep all that stuff in mind, you guys. Remember, skin stuff can really indicate an underlying piece going on, and whether it is cancer, which is a really prevalent thing in our society, guys. Like 9,500 people in the US every day are diagnosed with some kind of cancerous malignancy that's integumentary focused. So we need to not think, oh, this is never going to happen. This is rare. This is not going to be in my practice. If you think you're not seeing anyone with skin cancer, you're just not looking. So be sure you guys take off clothing when appropriate, check the skin, And when in doubt, refer out. All right, guys, make sure you have a great day today. The song of the day is Skin Thin by Ben Harper and the Relentless Seven. So have a fantastic Tuesday, and remember, I've got your back.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.